this lesson, I will be explaining gestational hypertension and the effects that it will have on the patient, as well as your role in providing care for the patient. So what does all of this mean? The patient with gestational hypertension is going to have an elevated blood pressure. Okay, so let's talk about that in a little bit more detail. It's just not a little elevated. We're looking at blood pressures of 140/90 or greater. And an absolute must have, they have to be over 20 weeks pregnant. So the fetus has to be measuring or be at 20 weeks gestation. All right, so the patient now, if she's under 20 weeks, so under 20 weeks, then she doesn't have gestational hypertension. This would equal chronic hypertension. So 140/90 or greater, and a must over 20 weeks. She's going to have no other symptoms. So if she had other symptoms such as proteinuria, then that means that she's progressing to something called preeclampsia. So there's a lesson on preeclampsia. Just refer to that for more detail on this. For this patient, there will be close monitoring just to watch, make sure she's doing well and the baby's doing well. She might need to be induced early. So she's going to have that monitoring, and if they find that there's a problem or the blood pressure is getting a little out of control, or she's progressing quickly and getting more severe, then she might be induced. So they might schedule an induction. Let's look at our monitoring. So what does monitoring mean? So for this patient, monitoring is going to look like lab work. So CBC, BMP, and checking that urine for protein, because we want to know if it's progressing so we can catch it and then treat it differently. Our assessment for this patient. So it's obviously going to be looking at the blood pressure. We're going to have an elevated blood pressure of 140/90 or greater, and there'll be no other symptoms, just that high blood pressure. Signs and symptoms are a signal that we are progressing to preeclampsia, okay? So we have no other symptoms, just that high blood pressure. Lab work assessment is done, and again, this is just to watch for the progression. So that's our CBC, our complete blood count, and checking the urine. And then the fetal assessment. So for this fetal assessment, we're going to check for growth, because with hypertensive disorders in pregnancy, it can cause something called IUGR, which stands for intrauterine growth restriction. So the reason why is because blood flow, good healthy blood, is not perfusing properly, and so the fetus can't grow properly. So they have IUGR. So NST, the non-stress test, and ultrasounds are going to be done. So the non-stress test is going to be to check on the fetal status and see how it's doing. And then the ultrasound will be to look at things like growth and make sure that the baby's not suffering too much from the hypertension. For our therapeutic management, so this is going to be things we need to manage the blood pressure, make sure we can keep the patient and fetus safe. So she will take antihypertensives, and that's going to be methyldopa and or labetalol. Those are two drugs. Labetalol is really our drug of choice here. So we'll give her these antihypertensives to try to control that high blood pressure. And then a possible induction. So if the treatment's not working well or things are progressing, then we're going to talk about a possible induction. For education, the patient's going to need education on signs and symptoms to report to the provider. So if they're already kind of watching those blood pressures, we're going to want her to let us know if she's got any headaches, an increased swelling, blurred vision, all signs that things might be progressing or that the blood pressures are not under control. So she needs to report that. We need her to also understand that it's important for her to learn how to take her blood pressure at home. So do home blood pressure monitoring and tracking. So to keep a log of it. That way the physicians can kind of take a good look at it and see what's going on. And then medications. If she's being prescribed certain medications like the labetalol, she needs to know how often to take it and if she should be taking her blood pressure along with it. The nursing concepts for a patient that has gestational hypertension are going to be reproduction, because gestational hypertension is caused by the reproduction. And then always remember there's a second life at stake, okay? So it's important to not only control the blood pressure for mom, but for the fetus too. Perfusion is our other concept because we are concerned with the high blood pressure and the organs, including the placenta, right? That's our big important organ right now. So we're concerned with that not getting perfused the way that they should. So let's look at our key points now. So the key points to remember and know are this in hypertension. We have our gestational hypertension. We have hypertension, and remember our number 140/90 or greater. So it can be higher. The patient has to be 20 weeks. This is our absolute must have, because remember, if it is under 20 weeks, it is called chronic hypertension. And then other symptoms, there's none. If we start to have other symptoms, then we're progressing. And then the risk. We have a small baby. It's growth restricted. So IUGR is a risk factor with this. Make sure you check out the resources that are attached to this lesson. Now go out and be your best selves today. And as always, happy nursing.